Thank you, everyone, and welcome to this webinar. We're going to be discussing our topic, assessing Cameroon's response to the COVID-19 pandemic. This webinar is offered to us by the Dennis and Lenora Foretia Foundation, hosted specifically by the Nkafu Policy Institute. We have guests and panelists. I would request Dr. Dennis to give us his opening remarks before we dive into the heart of the webinar.
Thank you very much, Dr. Ronald. I just wanted to quickly welcome the participants and wish everyone a good discussion.
Thank you very much, Dennis. We are honored to have some of Cameroon's brightest minds. We have Professor Rose Leke, who's the board chair of the National Medical Research Institute. She's Queen Mother Cameroon Medical Community and Emeritus Professor. Professor, you're welcome. We also acknowledge on our panel Professor Charles Wiysonge, who is the director of the Cochrane Center South Africa, South African Medical Research Council. He's a researcher and eminent personality. We are honored to have you, Professor Charles. These are our panelists. With this, we're going to go in and start. And we're going to allow the panelists to do some sort of debrief. Tell us a little bit, in a few words, a few sentences, your take on this topic. Browse on this topic, assessing Cameroon's response to the COVID-19 pandemic. And we're going to start with Professor Rose Leke. Professor Leke, you have the microphone.
Thank you very much for giving me this opportunity to, just brief you a little bit on my own way, what I see, what is going on, at least at the Institute for Medical Research and the Studies of Medicinal Plants, where I chair the board. And just to say, this institute is under the Ministry of Scientific Research. And being under that ministry, there are like 6 institutes. And when COVID started on, this institute is one, we have this center, we have different centers, but the 2 most important for this activity are the centers for the study of medicinal plants and the Center for the Studies of Emerging Infections. So these 2 have been very involved in the response that the government is making. In our board meetings, we had, first of all, we had an extraordinary meeting to ask about, because this institute had produced chloroquine before. So we wanted to, get back again when at least we know that in the treatment here in Cameroon, hydroxychloroquine is being used. So it was proposed by the board to see to it that we get at least 5 million of these tablets. The proposition for both hydroxychloroquine and azithromycin. That was the first board meeting. And later on, it was taken up, and the head of state did give that to the Ministry of Research, the production of hydroxychloroquine and azithromycin. When the Prime Minister announced this, the board met again to just make sure that we get on this and see how the follow-up is going. And the board, apart from just the production, like I said, in the center there, the board's also very concerned and encouraged the director to get in with the Minister of Health, Minister of Scientific Research, on working with traditional healers so we can develop African pharmacopoeia. And the Minister of Scientific Research herself has called, had a meeting with 5 ministers, like she said herself, you don't see that often, just with all the traditional, at least 20 some of these tradi practitioners and a whole morning with them, with the Minister of Health, Minister of Commerce, Minister of Basic Education, the Minister of Higher Education, and the Minister of Scientific Research and Innovation. You can imagine all these ministers interacting with the TADI practitioners, and we came up with some recommendations that I think will be followed. And the Institute of Studies of Medicinal Plants has been asked to really accompany these the TADI practitioners in what they're doing. So there are some tests going on there for their products that they have, and hopefully in the future we'll see this develop. I think it's been an opportunity to see the institute, growing to do more of this kind, and we hope we can develop better African pharmacopoeia. And apart the Center for Emerging Diseases, that one is working a lot on diagnosis, on the testing. It's a testing center, and thus is doing some work on the virology of this infection. So for now, I think those are the main things that the Institute is doing. That's a lot anyway to start with. And so taking this COVID-19, opportunity to at least to strengthen those parts of the Institute. And I think it's good, because what was asked for, I think the Institute is going to be able to deliver those. I think that my minutes are up. That's it for now, at least on the Medical Research Institute. Institute of Medical Research, Studies of Medicinal Plants, one of the institutes of the Ministry of Scientific Research. Thank you.
Thank you very much, Professor. We'll listen to Professor Charles.
Yes, so thank you very much for the organizers for inviting me to be part of this distinguished panel of accomplished colleagues whom I've always respected and admired. So I'm grateful to be here. It is important to remember that 6 months ago, today, the World Health Organization declared COVID a public health emergency of international concern. And you see, unlike the other panel members that are here, I don't currently work in Cameroon, but I will give you what I see and what I think is going well and where we could improve. Yesterday, I checked the Twitter account of Cameroon's Minister of Health, Dr. Manauda Malashi, and this is what he wrote about the COVID situation. He said that 149,000 tests have been performed, more than 17,000 confirmed cases have been registered, more than 15,000 recoveries, which shows a recovery rate of more than 88%, which one could say is impressive. But there are also some fatalities, and he reported a case fatality rate, that's the people who die after getting COVID, of about 2.2%. And this is echoed in what I saw written last week by Professors Sombi Ongoluzogo and others about the increase and then eventual rapid decrease of cases at the 5 treatment centers in Yaoundé, which they report that it has been sustained up to the 5th of July, which is when they had the last data. However, it's not all roses from what I see. I think that research has not taken a prominent role, and I'm happy to hear from my Professor Rose Leke that there are now plans to have studies of medicinal plants for COVID treatment. And that's one thing I was going to say, that I think we could have done better, and it's good to know that something is being done. I also saw in a publication last week by Wiysonge and Professor Fomban in the Pan-African Medical Journal that many health facilities lack equipment, personal protective equipment, and also, of course, insufficient health workers to be able to tackle COVID. However, I see the political leadership by the minister, having a scientific council, and also the use of face masks making them mandatory as very important. And I saw a modeling now that has been done by the Institute of Health Metrics and Evaluation, that Cameroon actually has a coverage of masks of about 60% to 80%, which is quite impressive, but it could be more. If it goes up to 95%, we could prevent many people from dying from COVID. Thank you very much.
Thank you very much. Thank you so much, Professor Charles. We're still expecting the other panelists to come on and signal. So we're going to go in and going to take from the angle of your comments. We know that COVID-19 has come to test the entire world. Everybody has been tested. And it wasn't a test like the GCE where you go and register and you choose the subjects. It just fell on everybody. And ready or not, the world, Cameroon included, has been tested. And we have no choice but to ask the question, how well have we done on different aspects? I want to zoom in on one aspect, the aspect of the healthcare workers. For the healthcare workers to do their job, they need access. They need access to infrastructure. They need access to medication. They need access to information on guidelines. They need access to protection for themselves and for their patients. In your assessment, I was one of those who was a little, not a little, but I would say I was touched when we had the announcement that Cameroon will produce chloroquine. This question goes to Professor Leke. We are in 2020. When the borders were closed, everything we used to import began to experience difficulty, and our health facilities discovered that paracetamol can go out of stock. I would assume that consciousness is hitting left and right to say that we can make certain things locally. We can make chloroquine locally, and possibly from this experience with COVID, make a lot more things. I would ask Professor Leke to, your comment was a lot in this light, in terms of what the institution is doing. I would ask to know, the announcement is almost a month and more. Where are the delays? What is our difficulty in becoming a production house for ourselves in terms of some basic medications? And I would ask you to also have a look at the private sector. The Baptists produce some medications here in Mutengene. What is holding the government back from producing basic things which are needed, pandemic or no pandemic?
Thank you. I can just, the president decided that hydroxychloroquine and azithromycin should be made here. But the structures are there, and it's just, you have to get. You don't just say it one day. When did this happen? When this came in, was in April or was it April or May? I'm just trying to think which month it was that decision was taken. Was it sometime in April? And April, May, June, July. Just give us some time. It's going to be produced. That one it had been. You just don't say do it. The money was the president gave. The funding is there, everything. But you don't just wake up one day. It had been produced before. There was the structure for it. But since for many years it hasn't been done, you have to, at least make sure you get what you need to put things in place and get, even just getting a manual for that, for the procedures, manual of procedures and so on. All these take a while. So, it's just since April, May, June, July. This is where we are. So you're asking us that in 3 months it hasn't been produced. It will be. It's going to, and maybe very soon enough. So that will happen. And I think it's going to give then, because it will give the Institute then the capacity to produce not just that, like you say, but to produce other, maybe other kinds of their drugs that the patents are gone. If we start having a production center as such, we'll be able to produce more drugs. I think COVID-19 has, taught us a lesson, like you say. This is what we should be doing more and more. And I think that's the way the government is looking at it, putting in money into these areas, putting in money in research. and doing the kinds of things that we didn't do before to make us, at least self-sufficient ourselves in many of these. So it's going to happen. So just a little bit of patience. It doesn't take 2 months to start producing and delivering hydroxychloroquine and the others. Thank you.
Thank you too. Just a quick question, a follow-up question. Is there any influence of the controversies surrounding the effectiveness of hydroxychloroquine on this delay? Well, you're explaining, given that we are in this emergency situation, does the fact that the usefulness of hydroxychloroquine is being debated, is it playing on the decision or the effectiveness of the institution?
There are a lot of studies that have shown that this is effective. There are studies showing it is not, but many studies also showing, randomized control studies showing that it is effective. I think that's the line that here is being taken. And if government encourages to do that, it's because they know that this is working. And so we are moving in with that.
Thank you very much. Professor Charles, I know you have keen interest in research, in evidence-based research. You are doing a lot to drive research worldwide. I would love to know, good research guides good policy. I think we can all, if we have an overview, we can say a lot of what Cameroon is doing or intends to do with respect to COVID-19 is important. The decisions, the guidelines are not based on locally generated data or locally generated observations. We're borrowing from what other countries are using. What is your view on the research drive within the country, and how should it change with respect to informing policy? We have been told that we should do so and so from other countries. What is happening in Cameroon? Just as a pointer, when we look at the data, in most countries, we see the age group most vulnerable being the older patient. In Cameroon, when I look at the most recent publication from Ministry of Public Health, it's the 30 to 40 to 50-year-old, which is the majority affected by COVID. What if our population is different? What if what we use as tools should be different? How do we get research going in this context?
Thank you very much, Dr. Gobina. And in that, I'm not going to answer that question directly, but I want to make the important. You have made allusion to the importance of research and the importance of having locally generated data. That also means that if there are trials, we also need to have trials done in Africa, in Cameroon. But it is often unfortunate. We are not, as you've alluded to, not a lot of research is happening, though we are doing the best we can. And we have an eminent researcher from Cameroon, somebody who has taught me and many others like Professor Leke on this webinar, and are doing the best that they can. Is that very often our communities are not research literate. If a vaccine is coming, for example, to be tested for COVID, what we have seen on the internet, on social media, the drive against this and the misinformation, actually, people tend to give you the impression that more research is being done on us than is done elsewhere. So in terms of research, I think the first thing too that we need to do is about building the trust with the communities, making people research literate, knowing that we need to generate locally relevant data. Like you made an allusion to the fact that the age group that is most at risk in Cameroon is different from the age group that is most at risk in other places. And it could also be that various other drugs might behave differently, or the efficacy might be different based on various things in Cameroon than in other places. So we need locally generated research. Well, it is important that there is leadership from the government, from the various authorities, both Ministry of Health and Higher Education, to invest in this and to put in more resources. We also, as a community, need to accept research and be willing to take part and contribute to this common good.
Thank you very much for your comments. The comments are coming even on the chat. Generating local data is very important. We do have a situation where a lot of Cameroonians are interested in contributing in one way or the other to the fight against the pandemic, but they don't know how to do it. There are young researchers who want to join research teams. In your area of work and your area of input into the fight against COVID, the question goes to both panelists, Professor Leke and Professor Charles. Can you tell us of any initiatives, research-driven research initiatives in Cameroon going on COVID that this webinar, the participants can be informed about? Is there anything going on in Cameroon?
Maybe Prof. Leke will start.
Yeah, there is a government, a scientific council at the ministry that the Minister of Health put in place, a scientific council that is accompanying all of this scientifically, all of this response. And they had asked for proposals, and many scientists have written, even my group sent one there in immunology, and this was followed, they followed it up, and we have ethical clearance. We have, I think, like many other groups, they have ethical clearance, and they also have the administrative clearance. So the work is ready to go. And I think these groups are just waiting for, for the funding, that hopefully some funding will come through. It's just taking its time, but at least to let you know that there are there's a lot of interest in research in this area, and waiting and I know people have also applied for collaborative research with researchers here, at the institute, again, like I said, Medicinal, Institute of Medical Research, Studies of Medicinal Plants. We have the area in emerging infections, where we have virologists there that are working on some of this. At the CRCB also, there are researchers there that, it's just been 3-4 months. At least you have to get enough samples and then start getting in on the research side. So there are scientists that are doing something now in the COVID area, carrying out some kind of research or planning to do so, or have proposals ready and just looking for funding for this to happen.
Professor Charles, any words?
Yeah, I think it's just to commend the various researchers like Professor Leke and the others who are putting in proposals to do research on COVID in Cameroon, and the fact that we have a scientific council that interacts regularly with the minister. I think that is very good. I checked yesterday, like the Pan-African Medical Journal, which has been publishing various studies on COVID-19 from Africa. There have been so many various publications from Cameroon. Of course, we're not saying that it is enough. It's important that the various studies continue, and that these studies are not just done because studies have to be done, that they are informed by real needs, that the studies, the priorities are identified, the interaction between the researchers, like we've said, and also the ministry, and also the public, to be sure that what we are, the research that we do, that the research would be used for policy, for practice, for various things. And it is not only about the research that concerns, that needs to be done in the laboratory or the clinical trials. One other thing that I think that is important that people could also do, and it's important to encourage, that there is also need for social and behavioral science research. Research both about how people perceive COVID and various other things that accompany it, but also the various preventive measures, or even the treatment, like we talk about masks, and that is one of the best tools that we have now of using, and it's very easy. People can easily make them or buy them, which are not very expensive, but people don't use them, or they don't use them correctly. They cover their mouth, but they don't cover their nose, but they think they have used a mask. So looking at various studies around that might not be very costly, would also be very important. And as other interventions are coming, everybody is talking about the vaccines, and if we ever have a safe and effective vaccine, then might bail us out of this pandemic. But it's important also to start planning and doing studies and trying to find out what people think about interventions like that, an eventual vaccine, and if they have concerns, and we see conspiracy theories around, what the concerns are and how we might deal with those in order to ensure that when the vaccine comes, we will all have access and there will be good uptake. So things are going on, but we encourage the researchers and encourage everybody to be involved and all the disciplines.
Thank you very much. We're going to move into a session of questions and answers. We'll take questions from our participants. And the first question, which is coming up, we would like to know, we know that the effectiveness of all the measures taken by the state depends also on their implementation. So the state has given guides and recommendations for social distancing and all of those measures for the community and for the clinical settings. How would you assess the receptivity of the Cameroonian public to guidelines put down by the Ministry of Public Health? Do we see effective in communities all the instructions and orientations given by the Ministry of Public Health? Do you see the community doing its part to fight this pandemic? What is the uptake of the Cameroonian community?
I guess in the beginning, we all know, I think this was taken very, very seriously, but there were a little relaxation, I think, yeah, for the benefit of the economy also, relaxation on this. And there was like kind of rejoicing at that point as if COVID was gone. And I think the government has really been insisting all the way through on this, wearing of masks, the social distancing, and the washing of hands. That is all over. People know that, but it's not happening. You go down the streets, and you yourself know you're there. You know that. You go down the streets, you see people without masks or the mask under the chin, and the local, distancing is something you find there's still, with burials and celebrations. If you pass on the road, you see huge crowds. Even on the streets here, you see people together. And the washing of hands used to have all these places, locations for doing hand washing, which are and they did it before even going to stores and so on. But it's not happening as much. But, we just have, it's the community. The community is taking it over though. We see that the mayors and people are taking it into the communities. So this, in my mind, I'm saying it can even maybe work better very soon in the communities than it is in the cities, like Yaoundé, so, and I'm sure Douala and other places, where people are going around really without the mask. If you walk around, you don't see it. But you can see, groups are taking these very, very important social groups, mayors and so on into the communities. So hopefully, it will improve, get better in those areas and maybe in the cities also. Because of all this insistence from the government on it, that's something, things will change and it will happen also in the state.
Thank you.
And if I may add, of course, I'm not in Cameroon, but what I hear from where I come from is, well, the sensitization, people are making masks and various tailors around the areas, and I've seen pictures and videos of people sharing masks and people using masks. So I think it is important that we continue, that each and every one of us, we have a responsibility to continue to sensitize the population. Like Professor Leke said, when there was a relaxation of the social distancing rules and the restrictions, people almost thought that this was it, that it was all over. But it is not over. There are still cases, and countries like Cameroon and South Africa, where I live, there are still cases, and many people are getting infected. So we still need to continue the hand washing, the sanitizing, the wearing of masks. The wearing of masks maybe is probably better in Cameroon when you look at the modeling, the Institute of Health Metrics and Evaluation which does the global burden of disease from Seattle, their latest estimates and models for last week show that Cameroon is about 60%, which is probably better than a few of our neighbors. But that is not enough. We need to go to, if we can go to near universal use of masks, where people wash their hands, everybody is still conscious. It's not for people to panic, but people are conscious that the virus is there and we need to prevent it. I think it would be very important, and we all have a role to play.
Thank you very much. Question from Kwecha Patrick. Thank you for making me part of the webinar. I would like to know how the Cameroon government is considering the use of medical plants to treat COVID-19. We have been hearing about Monsignor Kleda's treatment. Is this treatment recommended by the government? Professor Leke. And I will also ask, you mentioned the meeting with the minister and several traditional practitioners. Are there other candidates in terms of traditional solutions being proposed?
I can say for, the government is really getting us very involved in working with these traditional practitioners. Yes, they are looking into Monsignor Kleda's medication. Yes, government is looking, has asked that be looked into. The government asked that, like I told you, 5 ministers came together to discuss with traditional practitioners. That has never happened before. And so, of course, from that meeting, there are recommendations, and the work will continue and make sure that these traditional practitioners are accompanied. In the Ministry of Health, they have the whole document there where they can bring their take their medications onto improved traditional medicines. That's what usually, and then the government will approve it. Government cannot just say, you need some evidence of its efficacy, of its toxicity, of, there are elements there and criteria that these have to meet. And so the government, what they're doing is accompanying these people to be able to show, at least meet the criteria that are set before they're being approved as improved traditional medicines. So that is going on now more than ever. I hope I did answer.
Thank you very much, Professor.
Did you want me to add something around that? I think it is important, like what Professor Leke said. We know that there are, for any medicine, anything that needs to be taken, recommended to be taken by a human being, whether it is a medicine or a vaccine, it's very serious in the medical community. It must meet certain standards. It must be proven to be effective and not to cause harm, or at least the benefit should far outweigh the minor harms that might exist. And it's only in some of those situations that they can be recommended. But in the situation of traditional medicine, some of those studies will require a lot of resources, which we know our traditional practitioners or people making this, the herbalists, do not have. And I think it is important, like we've heard from Professor Leke, that the government is accompanying some of these herbalists and traditional medicine people to try to test and assess their drugs. And it is important that we don't relax the rules just because something looks very good, because somewhere along the line, if a problem comes, we will not be able to forgive ourselves. While we want to accompany the traditional practitioners, the herbalists, to be able to use these medicines, before it can be recommended officially, we need to be able to do a minimum level of testing of an assessment. And I think it's important that the government and the Institute of Medicinal Plants is helping traditional practitioners in that aspect.
Thank you very much, Prof. Another question points out to a phenomenon we saw happen in China, people dropping dead on the streets. And this participant is asking and commenting, we haven't seen people drop dead on the streets. So some people believe COVID-19 does not exist. Many things seem to be changing. For one, as Professor Charles mentioned earlier, that Yaoundé is already reporting that the specialized center for isolation of cases is becoming decongested. The cases are dropping, hospitalized cases are dropping. Things are changing. Even then, we have a lot of new cases still being reported. Cameroon has crossed 17,000 cases already. I would like the panelists to throw in their scientific thought on this. Is the disease presentation changing as time is moving on? In March, when the problem started in Cameroon, and in April, hospitals were full to capacity and cases died in their cars. I know cases personally who had no space because all oxygen concentrators were occupied. Is something changing? Or are we still moving to seeing people drop dead on the streets?
That is a difficult one. I think, thankfully, we have not seen that. I'm sure what people used to see drop dead, you know, I'm not saying that it's probably not true, but it's not everything you see on social media or what people are showing you is that it is, people can take things and they can even, using various technologies now to, they can manipulate various things. So we always need to take everything with a pinch of salt. So it's not probably, maybe it is happening there. It's happy that we are happy that we've not seen that. We're not praying that we're going to see that. But maybe there has also been I'm sure the treatment, maybe the treatment that is being used, the guidelines, maybe they're being followed very well, and that's why we have a very high recovery rate. But the cases are still out there, and the message that needs to go out is people need to take precaution.
Yes. We're going to go into the next phase of our discussions, assessing, we're still talking on assessing Cameroon's response to the COVID-19 pandemic. And here we want to share our thoughts on the way forward. We can identify delays in many aspects. Maybe we should be doing more research. We should have been producing drugs locally. We should have had more infrastructure, better infrastructure. COVID has opened our eyes to many things. And I want to ask the question, Professor Charles, you have a drive in research. How do we increase access to research? We have at least 3 comments from Cameroonians in the diaspora in the chat, and a few from Cameroonians in Cameroon who want to join you. Some are speaking directly to Professor Leke. I want to join you. I want to join Professor Charles. I want to participate. How do we bring this up? We know the government is doing a lot. And I think a lot of the other participants share my thought that we need policy and we need action. How do we translate policy to action? When do we start to see clinical trials on Cameroonian soil? Professor Charles.
Okay, good question. Usually, if a politician tells you it's a good question, that means there's no answer. there's no answer to that, but I'm not a politician. So I'm sure, well, I will also want to see many trials. And I think there are various structures within Cameroon. We have the various ministries and research institutions, one like the IMPM, where Professor Leke is the chair of the board. And I would imagine that if people want to get involved, get in touch with the various, Cameroon has various renowned researchers in various fields, that the first thing would be that you could you search and find out there are various publications from Cameroon in the various fields and try to get in touch with those people. And without making any promises, if there are people that you want to get in touch with, some of the people I might know or Professor Leke might know, and if you send to us, of course, within the constraints that we could also try to channel the contacts or the emails to the people whom you want to get in touch with. So, but it is important. We have various renowned researchers in Cameroon, people who are out in the diaspora who want to be involved and want to do research in Cameroon. They can easily get in touch with these people. And the colleagues that I know who are there they're all, of course, very busy. They would be able to get in touch and probably negotiate. It might not always be in every situation that you contact somebody or a researcher and there will be a common topic that the two of you could work in, or even an opportunity to work in, or there might be an opportunity and might not be immediate. So just creating that contact and the networks is actually very important. And there is a list of people who are in the Scientific Council for COVID, all eminent scientists in Cameroon. I'm sure their contacts are available, and that would be what I would advise for people to get in touch with. And if somebody is interested in a topic that involves me, I'm into vaccines. I do systematic reviews and things around knowledge translation. So people are interested in that kind of thing, and they want to get in touch with me or my center and other people in Cameroon. For example, we have a center in Cameroon that collaborates very much with the Cochrane collaboration with Professor Ongolozoko at the Central Hospital, the Center for Evidence-Based Practices, and they do a lot of systematic reviews. They do a lot of evidence-based research work, and we could connect people to him or his center and to other people. So yes, I think people need to network, and we need to collaborate and need to be able to grow our networks and do research that is responsible and that is responsive to the needs of our community.
Thank you, Professor Charles. Permit me also ask a question to you. Social media right now is full of videos and comments about vaccination. There's a phobia building up, and it's also present in Cameroon. People have the impression that they're being injected with a death sentence by whites who want to wipe us out. There are a lot of conspiracy theories. Do you see, maybe one of the reluctances for research teams to implement some of their projects in Cameroon is the context, is the climate, is the understanding of the people. Are we as Cameroonians reluctant or even resistant to research? I know there's so much going on in many other African countries. Is it an intentional design to skip Cameroon? We would love to see more, but if we can't answer the question of why, what is your take? Do you think a Cameroonian population will welcome and allow a research if you're into vaccination? Is there something going on in Cameroon? Where do we see this going?
Talking about research, we are probably not the best in Cameroon, the best in the country in the world in terms of research. But Cameroon is not doing very badly in research. There's a lot of research productivity in Cameroon. So that's one thing to admit. About vaccines, first of all, the conspiracy theories going around, the first thing to admit is we do not recommend a vaccine which has not been well tested, where we are not sure about the effectiveness and the safety. So most of those all those conspiracy theories that vaccines are all being used for whatever reason are false. For the COVID vaccines, there is no COVID vaccine now that is being used. But before a COVID vaccine is recommended, there are various structures. Professor Leke, who is on the call, is the chair of the National Immunization Technical Advisory Group in Cameroon. And there are many countries that have those groups, National Immunization Technical Advisory Group, that look at all the evidence and advise the ministers before they take a decision for any vaccine to be used. And at the global level, we have the Global Scientific Advisory Group of Experts on Immunization. They look at all the data. Like now, there are already groups studying the data, the research, from the animal research from the animal that is there. And as a research, before you go and approve a vaccine, you go through various stages. Usually it takes 15 years, 20 years to go from the research, from starting the initial idea and doing the research to having the vaccine and it being used. But now, because of various mechanisms that are being put in place for COVID, we might shorten that. People are talking about 12 to 18 months. And shortening that is not because the research will not be done in a way that the vaccines would be proven to be effective. No, that's not where the risk is. The research is still going through where people are going from animal to the phase 1, phase 2, phase 3 studies. But what is happening now is that usually when vaccines, you need to do from phase 1, and when it is effective, then they go now to phase 2, because these are very costly. They cost millions of dollars to do research in vaccines, and then you go to phase 3. And once it is proven, then they build the manufacturing capacity to be able to manufacture because it costs billions and you don't want to waste those billions. But what the world is doing now is that there are many various structures, like there's a group called CEPI, which is for epidemic preparedness and innovations, where people have put a lot of billions into that. And they are now seeing, and the Global Alliance for Vaccines and Immunization, the World Health Organization, and also some countries like the US, where they are saying that, okay, we are ready to waste the billions to ensure that we have effective vaccines. So now for all these vaccines that where the tests are, if a vaccine is showing promise from going to phase 1, that they show that it is safe, before they test whether it builds the immune system and whether it is effective, at that point, people are now starting to build manufacturing capacity, which is something that usually only happens 15 years after the trial start, the research start. But they are building the manufacturing capacity now, and they are going to be manufacturing those vaccines and keeping. And the test will go, the usual tests, so that when they are effective, then those vaccines will be ready. Because if you wait 15 years, we don't have 15 years for COVID. So that, but if they are not effective, those vaccines will be thrown away. Nobody would use any vaccines that is not safe. And that is why the billions of dollars are going to be wasted. And it is important to waste those because of the countries and the various charities that have the money to be able to give to this. But everything is being done, both at the global level and at the national level. I just stepped down now from the Global Scientific Advisory Group of Experts on Immunization at the World Health Organization at global level, where we look at the vaccines before we recommend to WHO, and then those recommendations come down to the regional level and to the national level. And we take safety very seriously. And vaccines are one thing where safety, because for the other things, for drugs, when you are sick and you go to hospital and they test very well to be sure that they are safe, but then at that time you are sick and you can take anything, you can accept a certain level of side effects. But for vaccines that are given to people who are well, to prevent them from getting sick in future, that is the more reason why care is taken, more care than with anything else. And that is, I can assure people and who are having all those conspiracy theories that they are wrong. Care is being taken that if any vaccine is recommended, it is because it is effective and it is because it is safe.
Thank you very much.
Can I add?
I can imagine. Yes, Professor, go ahead.
Yes, I just wanted to go back, I'll come through these and talking about the diaspora, for them to know that we saw here that they are forming an association of diaspora that's helping Cameroon. They were in parliament recently. So people in diaspora should look into that. And I think through that, they can always be able to do what they want to do for the country. They formed that association, number one. And for research, research is being carried in all the state universities and private universities. And you have research, and there are research institutes. And so if anybody wants to maybe, come in, like, it was explained by Charles, you can search which area you want to, and you'll find people that you can always, maybe in collaboration, maybe in helping. We're hoping that the diaspora really would help in some of these areas, especially in those research institutes where we are. And talking about about vaccines, the misinformation. I just want to say with this Sukafu Institute or what that, maybe you people have to help to counteract the misinformation. You've heard all that Charles has been saying about vaccines. If you even brought the COVID vaccine here in this country, now I wonder how many people, for the information we've had on this one now, on cervical cancer that was going to be going at all, what is going on about the misinformation and vaccines. We have to try and really get the communication to the communities about this. And maybe you all can help, because it's not only talking webinars like this where we have computers. You need to get down into the communities and get this education to them and let them see the benefits. If we don't do that, this misinformation continues. You will see in a little while, we'll have a surge. We've heard about measles will rise already in other areas, cholera is going up and so on. And because of COVID-19, and people are not going maybe to the vaccination centers as they should, we're going to, hopefully now there will be an improvement in that, but we might see in this country an increase in what all the gains we've made, whether it be in measles, whether it be in polio, whether it be in whatever, you might just see it all lost because of this kind of misinformation. And what's going on about people just talking about vaccines as if forgetting that vaccines, I tell you, for our African continent, you know, for our country, how useful they have been, how they have affected lives, you know, and how they've saved so many of our children and people. But we need some education into the communities about this misinformation, not only the communities maybe, and to the population as a whole, because it has really, it costs a lot. And I don't know what vaccine would really have the same coverage now as it has been having. Thank you.
Thank you so much. And I will call back on you, Professor Leke. Building on the vaccines will be, if we find a vaccine for COVID, it will be amazing. But with all the care that has to be taken, it will be several years in the line. We cannot expect it as a solution in the short run. And we know vaccine research is expensive. Cameroon is a low middle income country. We have limited money, even with all the help from outside. Professor Leke, if you were to point to one area or two areas where our spending should be for immediate relief from COVID, where do you think we should invest our spending right now?
I really don't think I can answer that question because I'm not, clinically working with this COVID patients. So I don't know what the need is in the hospitals. I can only tell you that research needs quite a bit of money, and hopefully that will come in so we can at least even know what we're dealing with as a virus. So the virus that we have here can be sequenced, and we can go from there and see whether it's the same like the virus that's happening all over, and move on from there to do more studies and seeing how these people are, what's happening. Nobody understands this virus. There's so many questions that one can carry on in research. And what is going on clinically, I tell you, I can't answer that question fully, but I will tell you that research needs quite a bit. And hopefully the money will come in, both from government and I think it is coming in, from government and from collaborations, so we can be able to answer the many questions that we need to answer.
From the meeting you had, probably was one of several that would come. I'm just curious to know, was it raised up at any point that we have some sort of a national registry of COVID in terms of characterizing epidemiologically where the cases are, who it's touched, and also clinically? Is there any such initiative? We know, Professor Charles will probably be aware of this, the WHO has even created a standardized case reporting form, and they are trying to get all member states to adhere, and so that they can have specifics about COVID from the entire world and be able to analyze. I think we need to move towards having a registry, not just for clinical care, but for the district health systems at national level, where we put in all our data from all around the country. Are there any prospects for that, Professor Leke?
No, if it's for traditional medicine, they've been working on a registry. They even have the association for traditional, doctors. They have a registry. I think things had gone on before long ago, but these ones, I say, were the 20 that really were chosen, were the ones that, they had looked into. I don't know how the criteria, I never really asked the chief of center there, what was the criteria for choosing this? But there were, Monsignor Cleda was there, and the other people whose drugs, they've, they're up there since they're effective. And like he said, and I told you, we just need to accompany these people. But there is a registry for sure, there is one. Even at the Ministry of Scientific Research, there's an area there for traditional medicine. In the Ministry of Health, there is, and there is such a registry. But we have to just accompany them to make sure that we make sure the drugs, have efficacious and non-toxic, and all these other criteria that the ministry has on the sheet of paper they give to them to be able to fulfill all those criteria before they are brought up to the level of a improved traditional medicine. And there are quite a few of these in pharmacies, improved traditional medicines. So if they can get to that level and fulfill all that criteria, accompanied by the Center for Studies of Medicinal Plants, they will be able, the government will recommend that for use.
Thank you. Professor Charles, any thoughts on where you would recommend a focus on government spending? Would it be to increase access to treatment, personal protective equipment? If you were to advise the minister, what would you tell him? Where should the money go? Bags of rice?
For COVID is not only a health, it's a health problem, but it has become an all of society illness. It has affected every part of society. It affects the economy, it affects everything. So I think the response should be multidisciplinary. As to any particular aspect where the focus could be, it's not something that somebody from outside can easily answer. I think that there needs to be a look at the evidence. It's good. Cameroon has the scientific council that interacts with the minister and with the policymakers and the political leaders to ensure that while evidence is not the only thing that should drive decisions, that evidence is part of the decision-making process and an essential part of the decision-making process, that there is interaction from whatever evidence we have of all the interventions, various sectors where the resources need to go through, and there are meaningful discussions within that sector of the scientific council and the structures above that to be able to put in the resources. But to point into as one thing that's the one thing that must be done, it is difficult for me.
Okay. Fritz Roland Fonken is asking, Cameroon seems to be ahead of the world to use the rapid diagnostic tests. What prompted Cameroon to take this stand? And is there any data to share on this? And we have, would any of the panelists want to comment on this?
Cameroon is, we're doing well with the rapid diagnostic tests. There are many testing centers and it's going, they've really sent it out. There used to be just about 15 before, but now it's all over the place. So we even have a testing center, the minister sent out now to get cases. They were in Mokolo Market the other day. Dr. Etundi was there in Mokolo Market with testing. And so they're going to go that kind of outreach testing as such that is going on. So I don't know if that's what they want to know. Yes, they're doing it, because believe you me, if we test more, then we'll find more. And we have to know where the virus really is, those areas. It's important in surveillance that you know where this virus is. So in testing them in different areas like that, we'll really know where the virus is and be able to tackle it, better.
And would you have any comments to make about, we know that the recommendations have evolved. WHO even issued a change on when to discharge patients from follow-up. Initially, you had to have 2 negative tests and then you're discharged. But then they've changed that and you don't need that 2 negative tests to be done, given the availability of tests. Does a rapid diagnostic test, I think one of the background thoughts of the person asking this question is about comparing the PCR methods and the rapid diagnostic tests. I know in my hospital where we test cases, it will end up doing a PCR. Do we have data that is guiding the use of the rapid diagnostic test?
So sorry, you don't have all your panelists there. That's none of us say. I can only say, they have a testing center at Cremer in the institute. And what they're doing there is the antigen test. It's a rapid diagnostic test with antigen. You have an antigen test, you have an antibody test. It's an antigen test, which is testing you for the antigen of the virus. Just like the PCR is molecular testing, but the antigen test is protein testing. They are still both, you know, antigen, PCR is the DNA, RNA, it's an RNA virus, sorry. It's molecular testing, and if you do it by the rapid test, it's the protein, viral protein that you're looking for. So this is, but knowing which I really, you know, I can't answer that. You add the other panel members, if Dr. Tunde were here, would be able maybe to say something about that.
Any words, Professor Charles? See, you wanted to.
Yeah, I think it is. You need to. It's unfortunate that not all the panel members are there, but with this, I would only encourage you that you engage with the scientific council and with the other members who have not been here, so that some of these questions that people have asked, that you have a mechanism of going back to them with the questions. And I think it would be, I can only imagine that the scientific council would be that an engagement with them, of course, knowing that they're very busy people, that you should be able to get back to some of the questions that we are not able to, or do not have the information to be able to answer.
Okay. Thank you, Professor Wells. Comments taken. Question from Fonken. Antigen tests need validation to be tested. There's reports in Spain about antigen tests, which was claimed to be 80% sensitive, but ended up being only 30%. We could be creating a bigger problem than solving one. And another question for Professor Leke: what viral protein is targeted by the rapid tests?
Oh, I've never mentioned. Sincerely, I wish I looked closely into that testing. I didn't go in to see which protein is targeted. But these tests are made, they are sent, and they do get tested for specificity when they get here. That I know they're doing, because I know I have some students that really haven't checked on which proteins, sorry. But they are checked for specificity, sensitivity when they get here, before, you know, in a batch, before they get used in the field. So at least we do that with the tests when they get here.
My next question goes to Professor Charles, talking about our capabilities. For us to be more effective, we need access to resources, we need access to infrastructure. I know you have been involved with a lot of research on the African continent. My interest, COVID or non-COVID related, how do you assess our platform in terms of initiating? I think a lot more is being from the comments that have been made. You people have suggested and advised those who are interested to join, get in touch with those who are doing research and join them. Can Cameroon initiate research? Is it something you see yourself advising or initiating on the Cameroonian soil? Do we have the capacity and the capabilities?
Okay, was that for me?
Yes.
Well, of course, research is, I see that Professor Tangwa has raised his hand there. Maybe he wants to answer that. He's a researcher too. But research is taking place in Cameroon. It's being initiated around there. So I think there's no question whether research can be initiated or even done in Cameroon, because the proof is there, the evidence is there that research is happening. Whether we could do better, any country can do better.
Thank you. Professor Tangwa, your hand is up.
Hello?
Yes, Professor Tangwa, you have the floor.
Okay, I see that I was unmuted. Well, I think first of all, it's a pity that some of the panelists that you had invited did not make it to this webinar. Now, Professor Wiysonge is saying that maybe I want to answer one of your questions. No, not at all. I rather have many questions that I would have loved to ask. And when I registered for this, there was an option for asking a question, which I did, and I had been waiting maybe that my question would be asked. So now let me just make a few comments on what I've heard so far. First of all, I'm really very happy to learn from Professor Leke that the government has provided funding for the production of hydrochloroquine and that it is underway. I think that the problem there is that, okay, 3 months down the road from when this funding was provided, the medication has not yet been produced. It is still in the process. And one can jolly well think that before we get to producing it, COVID-19 might be over. But it's a good thing anyway, a good start, because I think that the main thing here is that I don't think we are local enough. We are thinking global, you know, to begin with. In other words, we are coming from the global perspective to be looking at our own problems. I think it should be the other way, that we tackle our local problems, and whatever we find will then be reflected at the global level. Professor Wiysonge dismisses with a lot of confidence what we are calling conspiracy theories. But I don't dismiss conspiracy theories. Anybody who is familiar with the history of medical research scandals cannot dismiss conspiracy theories out of hand. So that is the issue, and the fact that our communities would find it very hard at the present moment, let's say, to get into tests. And this is something we need to work towards. They need to understand. But if they are reticent, they cannot be blamed, you know, because there's a history of exploitation of people, you know, because they are poor, they are ignorant, they don't understand what's all about, they are exploited. And international medical research is linked with commerce directly. And the controversy about hydrochloroquine is, in fact, if you look at it carefully, that is what is there. It is a struggle between competing interests. It's not about science. And there everybody is using science, doing politics, but the end game is the advantages, the commercial advantages that may be gained, and therefore we need always to be on alert. We need to be on our guard, and we need to sensitize our communities to be on the guard. Now there is an Institute of Medicinal Plants, and this is a fantastic thing that we have an Institute of Medicinal Plants. It should be working on our local medicinal plants, you know, but the way that it has been set up, because we are coming from Western medicine and the paradigm of Western research, we are not really getting into that in the way that I think we should. We should have concentrated on these medicinal plants. And if in fact what you are talking to local people is about medicinal plants that they know about and the research that maybe needs to be done, then they will listen and they will be interested and they will cooperate. If you go and say, oh, a vaccine has been made, so many billions have been put into it, therefore we are very lucky that it is there, and now we want to test it, you need to be part of the test. You cannot blame people if they are not interested in that. They know about exploitation. They know about the dangers, and all the rosy talk about it is even scientifically not warrantable. Because if we look at the COVID-19, what we can notice is that it's a virus that seems to adapt itself in every environment that it has been. That's why it's slightly different in every country where it is causing havoc. It's slightly different. And therefore, I think that here in Cameroon, we should have really just taken a very local approach and find out how this virus has adapted itself in our environment and what we can do. It's true that to do research, we need funding, but that's what the government needs to understand in the end and not be taking everything from the WHO, and from international partners. Tell me, why would an international partner be putting funding to do research here in Cameroon unless they have something to gain from it, or unless they are altruistic philanthropists, which usually they are not. If they are philanthropists, well and good, they will give the funding, but they wouldn't be interested in how you put it to use. But usually the funding comes with the rules and very strict rules of procedure. So I think that is the mentality that we need to change, and therefore change the paradigm and walk from the local to the global, not trying to use the global to adapt it to our own locality. So thank you. That's all I want to say at the moment.
Thank you so much, Professor Tangwa. Your contributions have been very helpful and very insightful. We're grateful. Thank you. Question for Professor Charles. You talked of a COVID-19 lethality rate of about 2%, though it is the lethality rate reported in the literature. But comparing lethality rates in Africa and other European countries, can we really say that the lethality rate in Africa is less? This is from Brian Bongbong Tamford.
Yeah, thank you for the question. And I must just thank Professor Tangwa for the comments. I think they are very great comments. I think there's nothing I can add to that. Maybe just to support you that for any research that needs to be done or whatever, people need to be engaged. There need to be good participatory practice, engaging the community in whatever needs to be done, and whatever decision of the research in this, the community needs to be seen as being part, not only seen as being part of it, they need to be part of it. They need to understand and they need to take the decision, and it should not just be something that is pushed down. And I take that very well. And I think if it didn't come out very clearly in what I said, I think it was an error, and definitely there needs to be community engagement in everything, and especially in research. For the question about the case fatality rate, well, I was looking at the information that I have, that we have there, and we all know, we have mentioned that already, no country is testing enough. Nobody has tested the whole country to know, in any country on earth, to know how many cases really there are, to be able to calculate, and or even the number of deaths. There are still deaths from COVID that are not happening in health facilities. And in places where we don't have a very good vital registration rate, it's even very difficult to know. So it's difficult. The figures that I quoted, it was a Twitter account from the Minister of Health, and I got those figures from there. And most of the other figures are publicly available, and that is the only thing we can work with. There are many modeling researchers or institutes that use that to model what maybe the true values are. But I was only, in that particular case, I only cited the publicly available data that has been shared.
Thank you.
Let me just make a final comment here, just to say about Professor Tango's comments were very, very pertinent. I just wanted to assure him that there is not an institute for medicinal plant studies, no. It's the Institute for Medical Research and the Studies of Medicinal Plants. And then there is a center in that institute. It has 5 different centers. And one of the centers is the Centers for Studying of Medicinal Plants. That's one of the centers. And also to assure him that even if, you know, it doesn't take, it's in 3 months, if we haven't produced hydroxychloroquine, even if it goes, if COVID-19 goes away now, great. I think we would have had the infrastructure and the know-how, which will continue with research and production. At least we would have put that in place, that if we don't do it for hydroxychloroquine, I mean, if it's not useful for that, it will be useful for many other diseases that we have. That's what I'd like to assure him. Thank you very much. Thanks to everyone. I have to leave. Thank you.
Thank you, Professor.
Thank you very much, Prof. And enjoy the rest of your day.
Thanks, Charles. Thank you. And thanks to the Nkafo Institute for this. And thank you, Dr. Gobina, for being the moderator. You know, it was a good panel. It's just too bad you didn't get those other panelists. I hope you'll be able to get them to respond to people's questions, because they are very, very important questions that people want to know what's going on. Thanks to you all. Thanks to the participants. Thank you, Charles. And you all have a good day.
Yeah, thank you.
Thank you, Professor. We'll take this other question. It's in French. S'il existe des plantes médicinales efficaces au Cameroun, ne pensez-vous pas que c'est l'Occident qui le mettra en évidence parce que les procédures scientifiques de validation du médicament sont difficiles à mettre en place localement? Y a-t-il des procédures plus pratiques pour valider l'utilisation des produits de la pharmacopée traditionnelle? So this question is this question is asking to know, are there any?
I think I got it.
Okay. For the interest of the other participants who are not French speaking, yes. Are there practical procedures in place which can be used to validate the use of traditional medications?
Charles, let me answer that before. Let me just answer it before I disappear, because I said there is everything, that even some of these medications already that have been approved. If you go to some pharmacies, you'll find some. There is a procedure, you know, they say you scientifically accompany them, which the Center for Medicinal Plant Studies does. They even do some work in the university on, you know, the efficacy, toxicity, and so on studies. Microbial studies that have to be done, standardization, and so on. When you do that, there are these criteria that have been put on. And once you can fulfill all that criteria and do all these tests and be able to show whatever is on that paper, your medication is called, you know, it's approved for improved traditional medicine. You know, and you can find those even in some of our pharmacies. You can find this improved traditional medicines. So there is all that structure. We don't need to go to any West. The country is able to do that. There's a body at the Ministry of Health that is responsible for looking at all that and guaranteeing that this medication can now be used by Cameroonians. Thank you very much.
Thank you, Professor. Professor Charles?
No, I think the Professor Leke is the most appropriate person to respond, and I think she replied to that very well. And that's, I was going to refer to her, to what she said earlier.
I think a lot of people observed the euphoria that was in the country when Bishop Clayder spoke about his treatment, and we saw huge donations coming from individuals and corporations, but we did not see the same kind of drive for conventional medicine when people proposed different solutions. We know of the cardiologist in Yaoundé who proposed a solution, and he had a very scientific or pragmatic response. Was a proof from research. We look forward to what solution traditional medicine can propose. But is there any grounds, any basis to treat the proposals from traditional medicine differently from the proposals coming from conventional medicine? Should we be less strict on those proposing traditional medicines? What is your take? And if Professor Tangwa can also make a comment on this question, we would love that.
Well, okay, let Professor Charles go first. I'll say something on that.
Yes, what I was only going to say is that if there is a preference for one or the other, there are probably some rules that are being followed, which I'm not aware of since I'm not part of that panel. So, yeah, over to you, Prof. Tangwa.
Well, what I would say about traditional medicines, especially herbal medicines, I think that they work within a very different paradigm, because they work in the understanding that the herbal medicines are very close to food, okay? And you've heard the adage that let your medicine be food, and let your food be medicines. In fact, many of the health problems that we have, they come from our food or the way we eat it. And I think that if we were to concentrate on treatment, then you think herbal solutions, even though they can be investigated, for adverse events and all that, but they cannot be put exactly on the paradigm of allopathic Western medicine, because allopathic Western medicine produces chemicals and tries to cure diseases through the use of chemicals, whereas herbal medicine is very close to the food that we eat every day. And therefore that has to be kept in mind. Now, the other issue that I should make a comment on is, you see, there is a distinction between research and treatment. And when anybody is ill, the first thing that is in the mind of the patient is to be treated.
Treatment, yes.
It is not to be studied. But you see that with COVID-19 and in fact, many other epidemics that we have seen here in Africa, the emphasis coming from the Western world is on research. They want to study, not to miss the opportunity to learn something. Whereas the first thing in the mind of a patient, if you are a patient, even if you are a researcher, once you fall ill, the first thing is that you want to be treated, not to be studied for the benefit of future people. And you can see that concentration on treatment has been completely neglected. That is, in fact, one reason that the herbal treatments that have been effective are being ignored, because those who have the money, they want to put it into vaccine, into a research for a vaccine. That's what will give money later on, you know. But I think that we ought to take very seriously, once people are ill, the fact that they need first and foremost to be treated. And if we had taken that seriously, taking treatment seriously, the herbal treatments that have proven effective here, effective in the sense that there are people who have had COVID-19, they have taken it, they have gotten well. That's what when we say that science is evidence-based, this evidence, okay, you are ill, you take it, you get well. So there's evidence that there's something effective there. Therefore, they should be taken much more seriously. And our dilemma is we are here, and we even depend on people from New York or Baltimore to be telling us what percentage of people in Cameroon are wearing masks. You know, I mean, Professor Wiysonge quoted 60%, so we are better than our neighbors because we use masks 60%, you know. But I think that anybody who is actually living in Cameroon would know that Cameroonians are not using masks at 60%. Unless we take wearing a mask on the chin as wearing a mask. People put it on their chins. If you get out in the markets and the open places, you see that Cameroonians are not using the masks. Therefore, I wouldn't rate it as an anecdotal observer. I cannot rate the wearing of masks in Cameroon at up to 60%. It's probably something around 10 or 15%. And so the bottom line is we need to concentrate on our locality. Go from the local, concentrate on what is bothering us, put all our resources into it. Of course, the snag is that the government is not yet into funding this type of investigation, these type of researches, therefore. But that is the way we have to go if we want to better the lot of our populations, you know. Instead of waiting for funding to come from outside, it will come with strings attached. And therefore, when we are exploited, we wouldn't know. In fact, I would recommend when we get to getting vaccines, that any vaccines that come in, they should be locally tested to be sure of what is the component of the vaccine before we start giving it to our population, you see, because if you know the history of medicine, medical research scandals, if you know the importance of profitability in commerce, and the fact that many of those who are driving these things, they are interested in profit, you know, and they would sweep many things under the carpet in order to get profit. Therefore, we need to assure ourselves and not be naive and get exploited or even get harmed because we have overweening confidence in people without any evidence. Thank you.
Thank you so much, Professor Tangwa. Very pertinent comments that you've made. Professor Charles wanted to say something?
Yeah, just to I agree with Professor Tangwa. I think for things like whether they are vaccines or drugs, what we should really recommend and what should be done is that every country has their own, the ethics committees are quite strong, that will strengthen the ethics committees, and even when we go to the research, that it is ethically sound, because research that is not ethically sound is not research. And also what Professor Tangwa talks about exploitation and what has happened with those scandals, definitely. Those are things that happened and we cannot deny that, and we need to be very careful. The fact that if they have happened, they might still happen. So we need to have checks and balances, having good ethics committees where people are committed and look at everything very clearly before they authorize, and things come in. Regulatory authorities, in principle, every country should be able to test any drug that comes, because even if things are licensed outside the country, each country has to license them and test them and authorize to be used in their own country. And I think Cameroon does that. They have ethics committees, they have the regulatory authority, and I can only agree with what Professor Tangwa says. This is very important. And also about research, people, we should, the priority should be about preventing the disease, about treating it, and not about research. So all the comments he made, if I wanted to go, I would just repeat all of them and say I agree with them, but definitely those are very pertinent points. Thank you very much, Prof.
Thank you, Professor Charles. Thank you, Professor Tangwa. We are coming to the end of our webinar. It has been enriching. I would ask Professor Wiysonge to give you a last word, and then we'll have our closing remarks. Any word?
Yeah,
yes.
Thank you for inviting me, and also thank you. I learned a lot from the questions here and from the discussions with Professor Leke, and I can only hope that the questions, very pertinent questions that people have asked and the engagement, that they don't end here, that those questions that you engage and they go to the researchers, the colleagues who can answer that, and that some of the suggestions that have come from here, that you are able to engage with the scientific council for COVID in Cameroon. They are all, I know a lot of them, very accessible, respected colleagues whom you can engage with them and be able to get the answers that people want, because it is important. And I think the end, we want to put COVID in Cameroon, we want our communities to help. And I just thank everybody who participated here. I thank you.
Thank you so much. I'm going to ask Madame Wiysonge of the Cameroon Policy Institute to give us closing remarks.
Thank you, Doc. And I want to seize this opportunity on behalf of the Cameroon Policy Institute of the Denis and Lenora Forecha Foundation to thank immensely our panelists in the person of Professor Leke for taking the time to join us today in enlightening the public on this topic, which is of concern to all and sundry in our country. As we all have heard today, we have to focus on information, passing on the right information to the public. We've heard that there's a lot going on in Cameroon with regards to the fight against the pandemic. And we've also learned today that even practitioners have been brought upon, and we have heard about the place of research in understanding this virus and to forge a way forward. For this, we call upon you to continuously join the Cameroon Policy Institute in the quest in giving our voice to this fight against the pandemic that is ravaging our country, our region, our continent, and the world at large. Please continue to check on our websites. We organize regular webinars on this topic, and we hope to join you in the nearest future to discuss these pertinent issues again. Thank you all for your kind attention. And over to you.
Thank you so much. We appreciate our panelists, those who are able to join, and appreciate all participants. Your presence honored us, your accepting our invitation was a great honor. We look forward to having you on. The Cameroon Policy Institute has a task force which is brainstorming to find solutions involved in several aspects: information, sensitization, research, and we are extending our reach, our actions on the field in Cameroon, and hopefully even beyond. And we'll welcome any of the participants who want to be a part of this task force to join us. You have received, if you look on the chat, the address to the Cameroon Policy Institute website, and there you will find a lot of information on what we have already written. You'll be able to follow up what we're going to continue writing, and you have the opportunity on that website to indicate if you want to be a part of the task force, and we'll be able to let you know how you can contribute to this concerted action against COVID-19. With that, we will call the webinar to a close. Thanks again. Thank you so much. Goodbye.